Hello, in this video I will explain MOGAD, which stands for Myelin Oligodendrocyte Glycoprotein Antibody-Associated Disease. MOGAD is a rare autoimmune disorder that affects the central nervous system. In this condition, the immune system produces antibodies against a protein called MOG, found on the surface of nerve cells. These antibodies damage the myelin sheath, a protective layer that surrounds the nerves. Normally, antibodies help protect the body by attacking harmful invaders like bacteria and viruses. But in MOGAD, the immune system makes a mistake. It wrongly identifies the MOG protein, which is a part of the body, as a threat, and produces antibodies against it. These antibodies attach to the myelin sheath, the fatty layer that insulates nerve cells and helps transmit electrical signals. As a result, the immune system ends up attacking a structure it's supposed to protect. Myelin is a fatty substance that speeds up nerve transmission and protects nerve cells. The MOG protein is a component of this sheath. When the immune system misidentifies this protein, the response can damage the nervous system and lead to various neurological symptoms. MOG antibodies are produced by the immune system. These antibodies attach to a protein on nerve cells called MOG. This triggers immune cells and starts inflammation in the nervous system. The inflammation damages the protective myelin sheath around the nerves, and over time, this sheath can break down. When the myelin is damaged, electrical signals between nerve cells slow down or stop completely. As a result, symptoms can appear in a wide range, from mild to severe. In some patients, the disease begins with symptoms like neck stiffness, severe headaches, or epileptic seizures. Sometimes it occurs as a single attack, but in other cases, repeated attacks can lead to progression over time. Different parts of the central nervous system can be affected, but the most commonly involved areas are the optic nerves, spinal cord, and brainstem. This can lead to symptoms such as vision loss, double vision, muscle weakness, balance problems, and urinary difficulties. The exact cause of MOGAD is still not fully understood. However, several factors may play a role in its development. Genetic predisposition is an important factor. Some individuals have immune systems that are structurally more prone to autoimmune reactions. In addition, certain viral infections, especially flu-like illnesses or viruses contracted during childhood, can disrupt the immune system's balance and cause it to target the wrong tissues. High stress levels, environmental factors, and unknown triggers may also contribute to confusion within the immune system. MOGAD is diagnosed through a combination of clinical symptoms, blood tests, MRI scans, and cerebrospinal fluid analysis. The most definitive test is the detection of anti-MOG antibodies in the blood. The main goal of treatment is to reduce inflammation and prevent the immune system from damaging the nerves. During attacks, corticosteroids are commonly used. In more severe cases, treatments like plasmapheresis or intravenous immunoglobulin, IVIG, may be preferred. For long-term management, immunosuppressive medications such as azathioprine, rituximab, or mycophenolate mofetil are used. Because MOGAD is rare and its symptoms resemble those of other neurological diseases like MS or NMO, it is often misdiagnosed. This can lead to patients being treated with the wrong medications for months or even years, allowing the disease to progress and cause potentially irreversible damage. In children especially, a delayed diagnosis can result in learning difficulties, seizures, and developmental delays. Patients who are misdiagnosed may feel isolated, misunderstood, and helpless. However, with the right tests and an informed approach, this disease can be recognized and effectively managed. MOGAD appears to be more common in children compared to adults. This may be because the immune system in younger individuals is still developing and may be more prone to autoimmune reactions. In children, MOGAD often involves more widespread brain involvement than in adults. It can begin with symptoms such as fever, confusion, seizures, and behavioral changes. The disease may also present as acute disseminated encephalomyelitis, ADEM, a condition characterized by widespread inflammation in the brain and spinal cord. With appropriate treatment, children often have a good chance of recovery. However, regular follow-up is essential to monitor for potential relapses. Therefore, it is crucial for both healthcare professionals and the general public to be aware of this disease. As volunteers of the MOGAD Solidarity Foundation, we are committed to working with doctors and researchers to ensure early diagnosis and to raise global awareness of the disease through our dedicated efforts.